Why is male pelvic floor dysfunction so misdiagnosed or dismissed is the subject of this video. In this video, I'll tell you more about some of the function of what pelvic floor is and what pelvic floor dysfunction is, and how anxiety and pelvic floor dysfunction are so closely connected. But before we begin, I want to make sure you understand that pelvic floor dysfunction is not just about basically sexual organ dysfunction. It's not about pain during ejaculation or intercourse or a heart flaccid or things like that. There are other presentations that you may not connect to pelvic floor dysfunction. So here's your pelvis, and you can have your spine connected to the pelvis, and you have your lower extremities that are connected to your pelvis. So you can have chronic lower back pain. You can have chronic sacroiliac joint pain. You can have chronic mobility and hip pain. You can have tailbone pain. You may have clenching of the butt, feeling tension in the perineum. Your perineum is that space between the base of the penis and the anus. You may have constipation. You may feel tension like as if the area between the base of the penis and the anus is just being stretched heavily. These are all different phases of pelvic floor dysfunction. What I have seen in my practice is that it seems like men hold their tension in the pelvic region. So that tension ends up presenting itself in different shapes and forms, different presentations. When it comes to anxiety, no matter who we're dealing with, anxiety causes tension. Anxiety does the fight or flight, it's as a result of fight or flight behavior, and that is a lot of changes in the physiology of our body. Inside this pelvis is not just muscles. You have pelvic organs, you have blood vessels, you have nerves, you have joints. All of those are in jeopardy when the tension rises, when pelvic instability exists. So there is 100% connection between your mind and body, and this fight or flight and its effect definitely manifest themselves in all of your muscles, including the muscles inside your pelvic floor, inside your pelvic girdle. So how do we go about handling this thing? When it comes to anxiety, when you start having panic, what do we say to people? Calm down, take a nice deep breath in. The reality is, when you do biological breathing, if you don't know what that's all about, make sure you subscribe to my channel, because I have talked about it in detail. I'll make sure I'll put it at the end of this video. But if you haven't subscribed to the channel, you're missing out on tons. I don't even know how many videos I have on YouTube that is related to pelvic floor dysfunction. So subscribe to it to educate yourself. They're all meant to educate you. But back to what we're talking about. In order to tackle pelvic floor dysfunction, we have to first start with biological breathing. Biological breathing is how we breathe. When we study human babies, we see they're all breathing the same way. You and I breathed like that before, and then we became dysfunctional even in that. So when we study biological breathing, we see that when we breathe in, it relaxes the muscles inside the pelvis, and the process of breathing out is initiated by the contraction of these muscles to exhale. So that means at a frequency of every breath, your body innately conditions these muscles. Why? Because conditioning of these muscles, relaxation of these muscles are absolutely crucial to your existence. So why are we looking for answers here and there when it's right in front of us? Let's learn biological breathing, and let's learn how the body moves. You don't need to become a doctor in biomechanics, but you gotta understand how this body moves. You gotta understand what right is, what your tendencies are, and replace yours with the right. You probably know more about the features of your phone than about your own body. And that's gotta stop. It's really, we're living a very unhealthy life. And the ignoring what we need to know no longer is going to, we're not gonna get away with it for as long as we have in the past. So we want to start with biological breathing, and we want to continue with developmental exercises. Developmental exercises are the same exact progression of movement that takes place when you're born until you become a running toddler. You see, every single walking human being on the planet Earth is born hardly being able to hold their neck up, and somehow they stabilize the pelvis, they condition the pelvis, all of their joints function properly, everything is beautiful, and then we go mess it up. So that's like the manual of movement. Every single human being on the planet Earth moved that way. So that is the manual of movement. Every manual has a troubleshooting section, and when you go look at that, there are different troubles, different issues, but the manual remains the same. Well, why aren't we doing that the same thing here? Whatever your version of instability is, the answer to stability, to get stable, is developmental exercises. And yes, you do need to learn it. So in my office, I make sure I transfer that knowledge to you. I make sure that you know what to look for, because at the end of the day, it is you that needs to have the critical eye. This is beyond pelvic instability. This is your postural stability. And your posture is not just what you make it look like. Your posture is a reflection of how your body's moving, how your body's holding. So in order for you to really tackle this issue, you've got to bring the right environment into your life and understand that anxiety is a different set of issues that is intimately related to all of your muscles, including the muscles inside of your pelvis. I hope this made sense. If you have not subscribed to my channel, make sure you do. Make sure you comment below. Hopefully you like and you share this with other people. If you need help, contact my office. I'll be more than happy to take a look, to chat with you and see what's going on. Until next time, take care.